The Michael Berry Show.
Several years ago, I was looking for an expert on Medicare and some issues related to aging because I came to learn once I dug in and took over my parents' finances. I mean, paying their bills and figuring out medical expenses and all this sort of stuff, that when you get to a certain age, for most people, your medical care, not the provider, but the system behind the financing, is Medicare. And that's going to drive everything you do. And I noticed something kept happening. Every time I would say to the doctors, who I know, these were his Golden Triangle doctors. I have him with all Houston doctors now. These are people who wanted the best for him as I do. And I would say, hey, this insulin pump is not working. I need you to switch him over to this. And they would say, well, we can't do that because Medicare won't allow it. Can't do this because Medicare won't allow it. And I would say, well, I don't care. I'll pay for it. I want the best. And Medicare was making the decisions for my dad. And I wondered how many people really understand this, because you're chugging along in life and all of a sudden you hit about 60 and you start winding things down. And whether you realize it or not, it's like when a woman knows it's time to have a child, or when a man knows it's time to settle down and get married. It's like the body starts accepting what's going on around them so that it's almost unconscious, this process. And at least in the past, people are working much later now. You get into those early 60s, you get toward the mid 60s, and all of a sudden 62 used to be Social Security. I mean, 62, you were an old person sitting at home waiting to die. And then all of a sudden, this process starts and folks start winding down at the office. Succession plans have been put into effect. And I think in many cases, it almost takes on a life of its own. And people wake up one day and they don't have a place to go to work. And all of a sudden, they get this barrage of robocalls and junk mail and all these things about Medicare. And they're thinking, what in the hell is Medicare? And what does this have to do with me? So we teamed up with a fellow named Justin White, Senior Health Services. And it took me a year of him being a partner of the show. And I would simply say, if you're on Medicare or about to be on Medicare, you need to call him or go to his website, seniorhealthservices.com. And lo and behold, as I did that, I started getting a lot of emails back from people saying, hey, your guy was able to help me a lot. Thank you. So I would keep sending him emails, but it might be late at night or it might be in the middle of a break, and I never could focus on exactly what he did and why it was important. But I could tell this was affecting our listeners. They were delighted. There's a combination of relieved and delighted, because it's sort of like when your kid, if your kid's thinking about college, somewhere around 8th or 9th grade, the school starts talking about it, they start talking about it, everybody starts talking about it, and you start into this whole process of college admissions and the portal and all this stuff, and you didn't know this whole industry existed. Or your wife gets pregnant, and all of a sudden, where are y'all going to have the baby? I don't know. And all of a sudden, we need this. They have a women's wing over here, and they have a thing. And this one has an apartment. You can stay there overnight. And this one over here, they'll give you foot massages. And this one over here, and you didn't know there's a whole industry behind this. And now you're swept up in it, and you're just the debris being pushed around. You don't know what the hell is going on. And it turns out that Medicare is like that for people. And this isn't, if you're under 65 and you're thinking, oh, this is for poor people. No, this is for almost everyone. And all of a sudden, something so near and dear to you as healthcare is related to Medicare, which you didn't know much about. You've just heard Medicare and Medicaid talked about in a sentence, like flora and fauna, and you're not sure what fauna is, but you've used it. And now all of a sudden, not only is it going to be a part of your life, but it's going to be a part of your life for what's going to be one of the most important parts of your life, which is your health care, at the very moment that you all of a sudden start needing health care. If you look at the expenditure of funds on health care in this country, take cosmetic out of it, of actual health care for chronic conditions in this country, almost all of it, a staggeringly high amount of it, is spent on people who are 65 plus. So now you're getting old, you need health care all the time, Medicare has come into your life, you have no idea what the hell's going on. So I have been trying to get Justin White, our show sponsor, on the show. We just haven't been able to coordinate the time because he slammed. And then with the big, beautiful bill, that made some changes. And today was the first day we could do this, but I needed to get this done because I'm getting the questions and all I can do is send them to him, which I'll continue to do. But I thought that sort of like with Anu Davis on menopause and Mohit Khera on testosterone, it was time. So, Justin White, welcome to the program.
Hey, man, thanks. By the way, tour de force. I'm not even sure I need to say anything. That was fantastic.
Yeah, I can tee it up, but I don't have the swing. So to start with, I understand that folks are moving around. You're coming, you're going, you're arriving, you're delivering, you're picking up, you're everything else. You can find him at seniorhealthservices.com. But as is always the case, if you're ever unsure as to a show sponsor of ours, not only is it not a bother, I enjoy it. If you email me and you tell me, hey, I can't remember the guy's name, I remember y'all were talking about, I will respond to your email and copy that person, not just Justin White, but any of our show sponsors, and I will happily connect you. And I love it when that situation, that relationship works, and I love it even more when you come back and tell me how that experience went. I use the person you recommended or you connect. A lot of people use that same email thread. So we're going to answer all your questions. If you have a question related to Medicare because you're on it or about to be, email me through the website, michaelberryshow.com, and I'll ask him while we're talking now.
Come join us. It'll be like old times.
Mr. Michael Berry
comes up with us at steak and ale.
Justin White is our guest. He's also a show sponsor. He's called Senior Health Services. I send him a lot of emails. I send him a lot of questions myself related to my dad, but I send him a lot of listeners who have questions about Medicare. Justin, there was a Jeopardy question last night. I have them logged for years, so it might be 2 years old. But do you know what color is the most common last name with a color in the United States?
Well, if you're implying anything, would that maybe be white?
It is not.
I don't know. I guess I don't.
It's brown, which surprised me.
Holy moly.
Yeah.
That was actually the first word that came in, but I thought you were being cute with my last name.
No. I was a little surprised by that. All right. So let's start with this. If someone is, let's say, early 60s, they're starting to hear about Medicare, or they're 50s, early 60s, and their parents are on Medicare, set the stage of exactly what that is for somebody that's just moved here and doesn't know what's going on and wants to understand the framework we're going to be talking about.
Well, it's that second scenario that's the most, for somebody that's in their late 50s and early 60s, and they're getting ready, there's really not a whole lot that they can particularly do for themselves because Medicare doesn't want anybody to sign up until about 3 months before the month they turn 65. That doesn't mean if they call and ask for information, we're going to send it to them. But where that's really relevant is for their parents. If these kiddos are assuming that their parents have got it all under control, don't. Because a lot of times the parents don't want to ask for help, or they're embarrassed to ask for help, or they're being kind of stubborn and don't want to. But we find some pretty bad things going on with parents that are sitting in plans that are not sufficient for what they want. And a lot of times the kids are completely unaware of what's going on. And so I would just say for them to get involved, asking questions about it. And we love when parents invite their kids on the phone calls and invite them onto appointments. That's the best type of appointment right there.
I like to think I'm pretty well informed, but I must admit, you and I have had this conversation a number of times, I woke up one day shocked at how immersed Medicare was into my parents' health care. How does that happen?
I think the need that grew through the years as seniors became seniors, and the insurance companies started looking at the costs that were going, they found that as we get older, we need more health care. And so eventually they started seeing that this was going to be a real problem as seniors got older with keeping health care affordable at all. And so they end up pitching the government, and Medicare came in to where they're like, look, you guys have got to come in here and help us cover our life expectancy is getting longer, and you guys need to come in here and help us with this because we cannot sustain this. We've got to put something in place to help our seniors with their health care expenses, much like Social Security. And so they did. And so, that's where Medicare came in. It was passed in 1965, went into effect in 1966 during LBJ's administration. And it's really just to subsidize what everybody knows is going to happen as we get older and we just disproportionately need more care. And so they've gotten in there and they collect a lot of taxes. And so they need very deep and wide participation in the workforce and the tax base to make sure there's enough money funding into that program to continue paying those ever escalating costs.
So what is the number one question you get related to Medicare?
The number one question is really, it's kind of a little bit overarching. They're like, I don't even know if it's a question. They make a statement. They'll say, I can't make heads or tails of any of this. We have architects and engineers and doctors and bricklayers and people come in, and some of them, the more educated, are actually annoyed when they call because they're like, oh my gosh, I've been looking at this for 2 weeks and I'm less sure of what I'm looking at than before. Can you sort this out for us? And I'm like, absolutely, we can. So it's just the utter amount of information and confusion that gets on all these folks as they're trying to navigate this system is it's just brutal. And I don't know, I stare at it all day, so I understand totally where they're coming from. And I don't know anybody understands it with all the changes and things coming down the pike.
I was in D.C. in maybe August. I think that's when the big, beautiful bill came down. And I asked you to come on the show because I was getting frantic emails. I forwarded those to you. And I don't know if you remember this conversation, but I said, can you come on and talk about this? And this one woman was horrified. She was scared. And I hate that because it's a natural thing. This isn't being scared about something, 8 countries away. It's your life. And you said we're not allowed to talk about that until X date. And it's not certain yet. It was in the bill. Let's talk about how the big, beautiful bill changed or the big changes in Medicare that affect people the most.
Absolutely. And yes, I remember that conversation. It was with a young lady named Jill. And I actually called her, Michael, to just kind of chat with her a little bit offline. So the changes, and I don't want to sound like a broken record, but the changes are still being driven by the Inflation Reduction Act. That Biden bill from 2022, that the carriers are beside themselves trying to figure out what to do with it. And just as a reminder to everyone, what that deal did is Medicare made massive cuts to Medicare Part D, which is where all the drugs are. And they sloughed them off onto the carriers and then brought a 20% coupon from the pharmaceuticals. So basically, the carrier's liability for the cost of all the prescription drugs, once it got into the phase where it really starts getting expensive, the carrier responsibility tripled from 20% to 60%. And Medicare just went on vacation. They just said, yeah, we're done with that. And the carriers are trying to figure out how in the world they're going to pay for it, and that is still, they're beside themselves trying to figure out what they're going to do.
Your calls are coming in, Justin White, seniorhealthservices.com. Your emails, I'm sorry. I will be asking your questions coming up. Seniorhealthservices.com founder and Medicare expert Justin White is our guest. Justin, I think I had to cut you off. I've got a number of questions coming in from listeners, but I wasn't sure where you were. on explaining what healthcare is. Why does everybody end up having to be on Medicare? I didn't see that coming. Can you explain that?
Yeah, it's just because there's so much subsidy that's needed to cover the seniors' health care. Again, that was passed at the behest of everybody. Everybody saw everybody living longer and realizing how much the senior health care was going to cost. So the public system was formed, obviously called Medicare, and so they need people to be in the system so that it is supported financially. That's just the long and short of it, because as we get older, we need more of it, and the insurance companies cannot they just can't shoulder that all themselves. So that's the reason it's got to be subsidized federally.
I wanted this to be something that helps our listeners, whether they end up calling you or not, but I want this to be something that helps our
Absolutely.
listeners. But I also want to take a moment and talk about policy. And if someone says, I don't want any assistance with all of that, they can opt out of ever using Medicare, right?
They can. They sure can. The easiest way to opt out of having to use Medicare is to continue working and stay on your group insurance through your employer, especially if there's more than 20 employees. They can work. I helped a couple of folks that were turning 80 that were coming off group insurance for the previous 15 years, and not a problem. There were no fines. There was nothing, and they didn't have A or B. So it was just a process that we went through, and all those fines that they would otherwise want to levy were waived because they had what's called creditable coverage. If you don't get Medicare and you don't have creditable coverage in place, yes, it's your prerogative to not be in there if you don't want to pay for it. But if and when you do decide later, oh, that was a mistake, I want to get in there, they are going to fine you out the wazoo if you have no insurance at all, or you've got a plan that they don't like. That could be a problem. So I would just encourage anybody, before you make that decision, to call someone about it. Call Senior Health Services, and we will give you some alternative options where you don't have to worry about coming in and having a big old fine that never goes away. There's ways to avoid some of those costs if you're not really using it that much, and we're happy to talk about that with anybody that's interested.
I am a big believer in full disclosure. It makes some people very uncomfortable. I ask people what they make. I ask them what their company makes, what your profit margin is on an item. And I know these are things that make people, very uncomfortable, like asking a woman her age or weight or whatever else. But
Sure.
I think these things should be very clear and very upfront. You always explain how y'all get paid, and I think people want to know that, because your service to our listeners is free to the listener.
Yes, and they all ask that. In fact, a lot. And by the way, the Michael Berry listener, not that you don't already know this, is the freaking greatest client ever. I love watching them walk in the door because I just love them. They're the best. And, one of the things for that is they're so conscientious, and this is across the board. I mean, somebody comes in, we'll sit here and go through this, or one of my agents that's working with a Berry listener, maybe somewhere a little further away from the office, and they all pull out a checkbook and say, what do I owe you? Even though we say it's free. And say, you put that back in your purse, or get your wallet away from me, and you don't owe us anything. And they're like, well, you spent an hour with us. And I'm like, look, we will let the insurance carriers pay us. So I'll just tell everybody that's listening on here, we get paid, but we get paid by the insurance companies, and we get paid just fine. And we are not going to ever get paid by somebody that comes and sits with us. There are folks in town that do that. They charge consultation fees, and I mean, whatever. I just don't like that. We don't do it. So their services are free when they're working with us, and we're paid just fine. And, the commissions and stuff that we get are standardized by the feds, and they're sufficient. That's all that I can say, to help people. We are happy to do it and pass on that services and whatnot to people for free, for sure.
Island Joe writes, Czar, I'm turning 65 next October, so a year from now. Anything I should do leading up to having to sign up? How close to 65 should I sign up? Should I keep my insurance through work? What is the biggest scam I should be aware of?
Great questions. Holy moly.
Yeah, let's
That's
start
awesome.
with how close to 65 should someone sign up?
They generally, and by they I mean Medicare, they want somebody to go ahead and start that process about 3 months out. And that's 3 months before the month you turn 65. So if he turns in October, you count back 3 months, and so that would be September, August, July. Starting on the 1st of July of 2026, he could call in here and we'll tell him exactly what to do, or we'll help him do it if he wants to come in. But July is usually what he wants to do. His effective date will be on the 1st of October, because it's always on the first day of the month you turn. And then once we get all that stuff in place, we can pick another plan that will help to offset what Medicare doesn't cover. But yes, generally 3 months out when you're turning 65 and aging in.
And should I keep my insurance through work?
If he is planning, at that point, I'm assuming he means once he turns 65. So obviously, yes, until he turns 65. Once he gets there, the question that I ask is, how long are you going to continue working? And if they say just, until I drop or whatever the answer is, sometimes people say, I'm not going to retire ever, or I'm going to retire at 70 or 67 or whatever. I'm like, do you like your plan? Yes, because those are creditable. I'll say, you work for a company with more than 20 employees. Oh, yeah, it's an oil and gas firm. Great. And do you like your plan? Oh, yeah, it's wonderful. Fantastic. Then I say it's completely up to you. If you want to stay in that plan, fabulous. If you want to go into let's see which one's the best financial deal for you and make a decision that's driven by dollars. And if their group insurance plan through their job is a better deal, it's really obvious, and we're going to tell them to stay there. And I had some guy come in the other day that his plan through his company was for free, and he was in because he thought he was going to be fined. It was a big company, and the company was very generous in giving him the insurance for nothing. And I looked at him, I said, Dennis, if you drop that plan, you're getting it for free, and you go into Medicare, you have lost your mind. You go away and you figure out when you're going to retire. And obviously I'm saying this tongue in cheek, we're laughing. But I said, you go away and you come back when you're going to retire, and we'll do it there. But as long as they're giving you insurance for free and you continue working, that's the key. It's got to be through your current employment or that of a spouse. Then you do whatever it is that you want to do. And, if we can save them some money by going into Medicare, which happens a lot, then we'll let them know. But I would say just review it. But absolutely he can stay in that, especially if he's going to continue working for a while and he likes it.
Next question, what is the biggest scam I should be aware of? And I will add to that, in case there's not a pure scam, pitfalls, things that most people make a mistake on.
So the biggest thing right now that we're having to unload and unwind a lot of are these dadgum phone calls. We get called all the time, somebody saying, I was moved plans and I have no idea how that happened. And I said, when was your phone call? What are you talking about? You took a phone call. He goes, yeah, but I didn't do anything. I said, well, they put you somewhere else. And so we have to go in and unwind that. I had a lady named Elaine that came in, and they literally put her in a plan with no drug coverage, setting her up for fines and all that stuff. We had to call Medicare to help her get that stuff unwound. So that's a huge thing. Be really, really careful. When you get an unsolicited phone call, it's probably illegal. And then the other thing for people already on Medicare, one of the biggest problems.
Hold that thought, Justin. Senior Health Services, Justin White's our guest. Your Medicare questions coming up.
Another thing about
Michael Berry.
He's got lifeless eyes, black eyes, like a doll's eyes.
Justin White is our guest of SeniorHealthServices.com. He happens to be a show sponsor. He's also a guy I send a lot of personal questions to, and I get a lot of listeners who ask Medicare-related questions, and I forward them to them, including friends who know that I have a contact in it. Sometimes you don't want to be the guy who knows the DWI attorney, the criminal defense attorney, the person who can get a stop sign put on your street corner, because then you become the one that everybody calls on that issue. Good news is I punt him off to Justin, and he seems to enjoy helping people. Let's talk, Justin, about like inside information. In August, you said there will be a time come October, and you agreed that by October 1st we could have these conversations because there were restrictions on what could and couldn't be talked about. What is, we'll use it as a season, use a sporting term. What does this season hold for folks?
Great question. Yeah. And the key, is there a season when I can talk? Yeah, there's no accident. It's today, because we can start chatting more in detail today. So right now, the carriers they're freaking out because of the Inflation Reduction Act. They're trying to find money. And when you talk to the heads of these things, they're like, we've just got to get through this year. I will look at these guys and say, what is the biggest cause of this? Because you can tell they don't ever act like this. And they say, it's the Inflation Reduction Act. We're trying to figure out how to cover all these meds and what we're going to do. So what people can expect is it's going to be a little chaotic. It's not all bad news. But like, for example, this morning, we can finally see our computer programs and look and see what's going on inside the plans and things in real time. And we've noticed I'm getting texts constantly from my agents saying, oh my gosh, the formularies have changed, meaning what drugs are covered and how they're covered. So we're going to have to go through and figure out. We've got 2 weeks, October 1st through the 14th, to kind of test everything and see what's going on, and so that we can start enrolling on the 15th of October. So you can think of the 1st through the 14th like a soft opening, like at a casino. And so we're going to be getting in there. We can talk to people about their plans. So the people that are sending stuff in now, we can help them. We can talk and visit. And then if there's any changes after the 15th of October, we can do it. But here's what I want to tell people. And I can't ever use absolutes because there's never any room for absolutes. But generally speaking, the larger carriers are the ones that seem to be under pressure right now. They seem to be under pressure because they got millions of beneficiaries. And when there's a hole that opens up in their finances, you times that times millions of beneficiaries, and there you go. So the adjustments, you're going to see adjustments come through, higher copays, higher maximum out of pockets. Doctors are shifting around all over the place. And that's the thing that's causing some issues with that. And people just need to look at their plans and figure out, can you stand what your plan's turning into for next year? And if you don't know what I'm talking about, call somebody. If you got a trusted agent, call them, or call Senior Health Services, or send us an email, and we will certainly help you. We got agents all over the area. But the other thing I want to make sure everybody knows, to give them some hope, is that the smaller carriers seem to be surging back and okay. So there are glimmers of hope out there for folks that got benefits that were cut back last year. You may find that the company you had to leave last year is all of a sudden slamming back into the picture this year with benefits that may be similar or better. You might need to make a doctor adjustment here and there, but there are good benefits that are out there, but it's impossible for them to know unless they look. And that was going to say that the biggest thing I see is mistakes is people sit out there and they settle in a plan and stay there for years because those plans are not as aggressively updated as the brand new ones are. And when somebody comes in and says, my plan's terrible, I'm like, how long have you been in this thing? 6 years. I said, well, that's why it's terrible. You know, you have not looked at it, or their agent's gone. You know, you have that kind of stuff happen. So just have them look. And if they have any questions, my gosh, call and ask somebody. Jill, who you sent that deal back in October, she was worried that she thought her plan was being canceled. And here's one of these inexplicable, ridiculous things. Her company, they just renamed everything. So her plan's not being canceled at all, but she doesn't recognize it anymore because it has a new name. And I don't know why they do that. They've got ridiculous reasons for it, and I guess they make sense on one level, but they do that from time to time. A couple of years ago, a company did that. They took off their reasonable names and identified all the plans with this random serial number. It's like, oh, great. That's real helpful. And nobody, including the agents, we had to sit there and stare at it so we even knew what they were. So it's little things like that cause so much confusion. And I just tell people, don't do that. Don't settle. Ask questions. Get out there and just inquire and be aggressive so that you can be in a plan that's going to be most relevant to the stuff that you've got going on in the future. When in doubt, reach out.
Scott writes, I've been paying for Medicare through auto deposit, 3-month payment, and I will begin receiving Social Security payments beginning this month, and notice the Medicare payment will be deducted from the gross amount. How should I handle the ending of the auto debit so I do not double dip?
Man, that is such a great question, and I'm going to be useless on that. What I would say is for them, and I'm sorry that you said his name's Scott. I'm sorry, Scott. I would call Medicare and ask them that question. Just rest assured that one thing they're really good at is returning any overpayments. It might take them a couple of weeks, but they will return them. What you don't want to do is have your Medicare Part B lapse. But yeah, you're exactly right. Once that Social Security starts, within a month or two, they'll have it deducted. The Part B print payment will come out automatically from the Social Security. But that little dovetail thing, man, that's kind of a minefield, and I would give them a call and do exactly what they tell you to do. And if you overpay, they'll get it back to you.
Catherine asks, ask him about Medigap versus Medicare Advantage. I've heard Medicare plus Medigap is far better and cuts out the barriers that med or rarely refused a treatment. Is this true? I think we're up against break. We are. Hold with me. We'll hold Justin White over for a bit. Their website is seniorhealthservices.com. And if you can at any point not remember the name of a show sponsor or who was that guy you were talking to the other day about so-and-so, and you email me, I will be delighted to connect you myself. Justin gets a lot of emails from me, from listeners. Trust me, there's a pipeline of steady flow of folks who have questions. It's just scary stuff. You or your parents are entering that age, and this is your health care, and it matters. I'll tell you what, if you were to plan segments based on thank yous you get from people desperate for more information, I would do menopause on Monday, Medicare on Tuesday, how to hire good people, where the good people are to hire on when. I mean, these are things that people are, wiener drugs and testosterone on Thursday. And then what would we do on Friday, Ramon? Weight loss. We do weight loss on Friday. Yeah, and that'd be it. That'd be our show. I mean, in terms of number of people reaching out, thanking us for information, right now, if you saw my screen, longer than the screen is number of emails that came in just the last couple of minutes. So I have to scroll down to even see all the emails. Justin White is our guest of seniorhealthservices.com. The question going into the break, Justin, Catherine asks, ask about Medigap versus Medicare Advantage. I've heard Medicare plus Medigap is far better and cuts out the barriers that med or rarely refused a treatment. True?
Oh my gosh, that's such a great question. This is probably one of the biggest questions that we have. Is this exactly this? Because if you ask 5 people this, you're going to get 8 opinions, and they're all going to be different. It's going to confuse the crap out of you. So first off, Medigap is what they pay a premium for. So you'll pay a premium, and it does give you more freedom generally to go when and where you want to go. There's no referrals, and it is good. Now the problem with Medigap is that premium is going up, and it's going up disproportionately right now, and a lot of people are running into problems affording it. But those that have money and they know what they're buying access and convenience, and they travel a lot and things like that. So it does work really well. But it only does hospital and doctor stuff. It's not going to do any extra things, no ancillary things. So people have to keep that in mind. But the first thing is just affordability. The Medicare Advantage plans are big federally sponsored group insurance plans. That's where your HMOs and your PPOs are. Still, most of them still don't have any premium, believe it or not. There's a premium, but the government's paying it. So we find very definitively, and this is one thing you can know from Senior Health Services, is we are not going to shoehorn you into one or the other, because one thing we've learned is we've got to ask questions and determine who we're talking to. And there are very definitely Medicare Advantage people, and there are very definitely Medicare supplement people. And I have learned long time ago, thankfully, that if I take a supplement person and put them in Advantage, or take Advantage person and put them in a supplement, I'm going to hear about it. And it's not going to be good. People generally, once they get in the plan that fits their personality and the style of care that they want, regardless of which one, they're generally very happy. Because the satisfaction rates in both of them for long-term members are very high. It's just a matter of having somebody that you can ask questions of to determine which one suits the type of coverage that you want.
Justin White, seniorhealthservices.com is our guest. Tom writes, good morning, Czar. My primary care physician has been requiring 2 visits a year with blood work. He said because I'm on regular prescription of 10 milligrams of lisinopril, lowest amount that can be prescribed. I went to the Medicare website Q&A and found that there was no requirement for 2 physicals a year. That was very disappointing. There's not a question, but do you have a thought on that?
Yeah, there are a couple of meds that require, frequent follow-ups, but I agree with him. I've not heard that lisinopril is one of them. So yeah, they're just a lot of confusion and chaos and things, and sometimes the plans they'll require a couple of extra visits, and I don't want to wander off too much in the weeds because I can't speak entirely.
But let me just say this:
it doesn't surprise me.
I'm not the expert here, but I don't see a problem with 2 physicals a year other than the cost and the time, and nobody wants it. I get my blood drawn more than any human being you'll meet because I believe there is a lot to be learned from blood, and especially I have a baseline for my hearing, for my testosterone, for my BP, and once you establish a baseline, which is what I think everybody should do, you create the norm based on testing long before you need it, then the minute you notice something is off, you can catch things early. If you don't have a baseline, you don't know if your numbers are higher than they were last year, which is a problem. It's the delta that matters. So I think go get your physicals and go get your blood tests if it doesn't cost a lot and you have the time. Cindy from Beaumont says, how do they determine your premium for Part B and Part D? I believe I read they use your tax return from 2 years ago. Unfortunately, I will not be making anything close to that amount once I start drawing retirement and I'm no longer working. How is that fair?
Yeah, well, there's good news for her. So I will tell you. So yeah, they do. She's absolutely right. Once you go into Medicare, they're going to means test Part B, and D, as a matter of fact. And the Part B, the standard monthly premium this year is $185. It's going to go somewhere just over $200 for next year is what the estimates look like. And if you make more than a certain amount, they're going to make you pay more, and they go back 2 years to your tax return, and they look at what's called the modified adjusted gross income. And so Medicare coordinates with the IRS to figure out what that is, and then they send a letter saying what it's going to be. The good news for her is that when you retire and your income collapses like it often does, it doesn't collapse necessarily, but it's less than what you're making when you're working, there's an appeal form that she can turn in because work stoppage or a great decrease in income is a life-changing event, and they can appeal whatever that thing. It's called the IRMA, the Income-Related Monthly Adjustment Amounts, what they call it. And she can appeal that IRMA and get them to send in the documentation that they want. And we've had a lot of people have success turning that thing in and getting that thing lowered or eliminated entirely.
Hang tight, Justin White. SeniorHealthServices.com. Either you or your parents are on Medicare or will be soon enough. We'll get your questions answered coming up. Arlene Hayes, Czar, many medications are new and don't have generics, and they're super expensive. Medicare RX coverage pays for more of these. Please ask Justin if he has any suggestions for how to deal with this.
Yeah, great question, and that is the epicenter of what's going on right now, is centered around those drugs. So I will tell everybody, get your plan reviewed for sure. Medicare does a really good job on generics, but as she's implying, in my opinion, Medicare does kind of a crappy job on the brand names. But the good news is, one good thing that the Inflation Reduction Act did was it brought in an annual cap. This coming year, it's going to be $2,100. And it's weird how they figure that out, and none of us have time to go into that now, but a $2,100 maximum, out of pocket, so that once your cost or whatever they credit to you is $2,100 and above, all your meds drop down to zero. So that may make her feel better, may not make her feel better, but everybody's going through it. And I would say call in, let us review it for you. And if there's something that we can shift her over to that'll give her some relief, we'll certainly do that.
Dell writes, I am a disabled veteran 100%, so I have VA. I intend to retire next year. Do I shift to Medicare when I start Social Security?
Thank you for your service, Bill. Appreciate that so much. That is such a great question. One of the dumbest things in our country right now is that VA coverage, believe it or not, please everybody hear me say this, VA coverage as it stands right now is not considered creditable to waive Part B. So if we have a veteran that is using that benefit that they earned and they say, you know, I don't need Medicare right now because I've got the VA coverage, and then you try to enroll later, they're going to fine people for not signing up for B when they had the chance to at 65. So what I would tell Bill is, Bill, give us a buzz. There are some ways to get you into that with not much additional cost. We could discuss that when you give a buzz in. But you can stay on the VA, and if you think that's where you're going to go for the rest of your life and you don't want to use any outside doctors, then by all means, you can do that. But if you want some leeway down the road and you think you ever will need Medicare, I would highly recommend getting it in place and talk to us about some ways that we can offset that cost so it doesn't kill you. Because right now you're getting it for nothing, and you add Medicare and you're like, I don't want to add that cost.
Sure.
Just call us. We'll talk about what we can do.
Justin White, SeniorHealthServices.com. Scott writes, how about asking him about United Healthcare plans to drop some Medicare Advantage plans that cover over 600,000 people?
Well, they are all, remember what I said earlier, those big carriers are the ones that are just they're kind of settling in. They're hibernating a little bit this year. Not all of them, but a lot of them are. And a lot of them are dropping different plans in different areas. So depending on where Scott is, he may be in an area where they're trimming some. They're not trimming everywhere. So to find out how much something's going to change for you or whether there's a better option, the best advice I can give is to get your plan reviewed, because we'll be able to tell you whether it's staying, going, and just what the changes are. Because at the end of the day, you need to know how it's changing so you can decide, do I want to stay here or do I want to look for something that's going to possibly fit me better? And the only way that you can do that is with the review. But that's a good question. United Healthcare and Humana and Aetna, they're going nowhere. They're around. And if you like that plan and want to stay there, you certainly have that prerogative. But you do want to make sure you're not in an area where they're canceling some of them, because that will happen. And it's not just them. It's across the board. All the plans are making adjustments like that.
Melanie writes, my father-in-law is 85 and his current plan does not cover hearing aids. Are there any plans that do? I'll expand that to a number of medical accessories. Justin, what do you say?
Absolutely. It depends on what her father-in-law is on. If he is on a Medigap, on a Medicare supplement, then the hearing aids, he'd have to actually add a plan in order to get coverage on that thing if he decided to, and at 85 that may be hard to find. And most of the Advantage plans do have some benefits in that direction, and it just depends on which one he's in. But yeah, I would definitely, if that's something they're looking for, there should be coverage possibilities. It's just a matter of whether that possibility is what they want to enroll in.
All right, I'm going to go more rapid fire, so if you keep them a little shorter.
Sure.
Sorry, I'll assume this is a joke, but it's funny, so I'm going to read it. You don't have to answer. For our aging liberals that may be confused after all these years, do any of these plans cover gender transitioning care? You don't need to answer that. Janet writes,
no.
Czar, please ask Mr. White with a Medicare supplement if I can file an insurance claim myself. I'm returning to Houston and found the doctor that I used to use does not file insurance. His prices are so reasonable, but I was wondering if I could file them myself like in the old days.
And it's on a Medicare supplement?
Yeah.
Yes.
Dang, I said be sure. I wasn't ready for that. That's awesome. Okay. Laura writes, is it true that if you retire at 65 and elect to not have Medicare, you will lose your Social Security benefits?
That is not true.
Man, he takes orders, doesn't he? PD writes, Czar, I was wondering if Justin can help me because I don't live in Texas. Do all states have different rules and plans for Medicare? I live in upstate New York. People, anyway, you get the question.
Yeah, the beautiful thing is Medicare is a federal program, and there might be some little state things, but for the most part, Medicare is intact as a federal program. And I would say call in. We've got people up there that can help with that if they need it.
I'm going to consolidate this next question into a broader question because there are a lot of them coming in. Currently have Medicare and TRICARE for life, 90% disabled through the VA. Should I keep Medicare or drop it? I'm 66, U.S. Army retired combat veteran from Desert Storm. A lot of emails coming in on VA-related issues. Your thoughts generally on that?
Those guys, the TRICARE for life, my understanding is that, and if there's exceptions to it, I'm not aware of them, But my understanding is they need to have A and B in place for TRICARE. So anything that he's wanting to make adjustments to his, and I just take a little longer to answer since he's a veteran, I want to make sure we get that right. I would have him call the administrator of that plan and ask that question to them. Generally speaking, when somebody's on TRICARE, my in-laws were on TRICARE, and I left that thing alone because I didn't want to screw anything up with it, and that would be the thing I would say for them. So call them and ask them that, verify the things, and, we're happy to talk with you as well, but I would have them go right back there and just make sure that you're not doing anything that would jeopardize those well-deserved earned benefits.
I'm up against a break, but I can tell people have a lot of questions and don't know where to go to get answers. SeniorHealthServices.com. Justin White is our guest. We're going to hang tight with him for a bit more. Keep your emails coming in through the website at michaelberryshow.com. Get right to the point so I can ask them easily.
Bring it on, because there is nothing here.
The Michael Berry Show.
I have appreciated that I'm able to send folks to Justin, and a lot of them, he's not able to ever make a penny off of the way the system pays, but I get emails that he took care of them. He helped them. What made me think of all this, I got an email from Sal who says, just had my mother's husband die. He took care of everything. Now that he's gone, it falls to us to help. We're definitely contacting your guy. Do they do Social Security as well? It's at the point where the Social Security office has her in tears. We can't figure out the death benefits and the withdrawal. Can they help, or can you? See, if you work at the Social Security office, it's like working at the mortuary. It's like being an officer on homicide. You got to realize you're catching people at their lowest. I mean, you got to do better. They're human beings, and they're in a bad position. But anyway, do y'all do any help? Do y'all help with anything on Social Security, Justin?
I'll tell you, we can. It's going to be more limited, so I don't want to overpromise what we can do, but we'll certainly listen to them, and we'll help to try to find somebody that can help them for sure. So yeah, if they have an issue like that, please reach out to us, and we'll do the best we can. If it's a simple thing, we'll do a good job. Otherwise, we'll just work together and see what we can do.
All right, I'm going back to rapid fire. You can reach him at SeniorHealthServices.com. If you can't remember that, you know where to reach me, MichaelBerryShow.com, and I directly connect you. Judith says, I feel this is a big scam. I was scared into enrolling because of the penalties for not enrolling in Part D about 15 years ago. My current premium is $115.70 per month. To date, Medicare Part D has paid a total of $0. I feel I'm just paying for Medicaid patients. Is there an alternative? My husband ran into the problem of any new medication, quote, was not in Medicare's formulary, and Medicare Part D paid nothing. Also, what I pay at the pharmacy is a lot more than the Medicare Part D EOB says. As a widow of a doctor, I just don't trust Medicare Advantage's plans, as they tend to have very limited diagnoses to justify payment, some of which do not make sense. It's a lot packed in there, but can you take that, Justin?
There was a lot there. And as far as like what she said at the beginning about signing up for Medicare because she was scared of being penalized, we get that all the time. And if she's on a group insurance and not retired yet, then she was, I don't want to say scammed, but she was misled to think that you have to sign up. We get people all the time that do that. As to the rest of it, it sounds like she just needs somebody to look at those meds and figure out which plan is going to fit and have them on formulary. I will tell those listening, Medicare generally does not cover compounded medicine. So if it's compounded and is like hormones and things, it's not going to be covered. But if it's other stuff, we just need to run it and see which one's going to fit and has the more expanded formularies.
Joanne writes, Czar, I'm eligible to sign up today for Medicare. Perfect timing for your show. I understand parts A and B. I will be eligible for an Advantage or Advantage plan provided by UHC through my former company. I don't understand if prescriptions are part of the Advantage plans, or do I need a Part D supplement for prescriptions?
That's a fantastic question. Generally, Joanne, drug coverage is included in those plans, and if you're working with some, they'll tell you that. Now, there is some differences on stuff that comes through an employer. Sometimes they will have a separate plan does not happen in the individual area. So I would call the plan administrator and ask them how you get your drug coverage. Is it actually through that group Advantage plan, or do they have a group prescription drug plan? And just make sure. They'll tell you what you need to do, and you should be golden.
I double printed that one. Kenny writes, I turned 65. This is Kenny Wittenberg, and I know him, so I'm not sure if my advice was correct, but you can check my work. Kenny Wittenberg writes, I turned 65, subject, Medicare. I turned 65 on November 21st. What happens if I don't sign up? And I said, well, you'll be 65 and you'll die soon enough. Don't worry about it. Because he's a friend, I can say that. But is that the right answer?
Well, is that the right? Yeah, I guess in an existential way, it certainly is. But no, if he doesn't sign up, I mean, I would just make sure if Kenny doesn't have anything in place, like if he's got an ACA plan or if he doesn't have insurance and doesn't have any insurance and does not sign up at 65, that's where penalties could possibly come in. If he's got employer coverage and there's more than 20 employees with the company where he works, then whether he signs up for A or B is completely up to him. And so if he has that, he'll have creditable coverage, and he can go down the road, decide when he wants to retire, and then we'll help him sign up when it's time. If it's less than 20 employees, he probably needs to look into going ahead and getting into Medicare. So that's kind of a convoluted answer, but that's the one.
Justin White, SeniorHealthServices.com. You notice they don't name girls Valerie anymore? Like there were a bunch of Valeries, and then one day the last Valerie was named, and they said, that's it, no more Valeries. We're out of Valeries. Valerie writes, I'm 76 on straight Medicare with Aetna Continental Life. I take infusions for RA, have had an aorta valve replaced, had breast cancer, and now have an aortic aneurysm. I've been told in years past that because of my issues, I cannot change my supplement insurance without risking much higher costs. Is that still true? And let me lump into that a number of pre-existing condition questions, Justin, and whether someone can change midstream if they have these pre-existing questions. I know that's a big one for folks, especially as they get older. So can you tackle all of that?
Sure. I was going to say Valerie is in the plan she needs to stay in. If Valerie came and saw me, Valerie would leave in that plan because there's no way, given what she disclosed there, and thank you, ma'am, for your transparency, there's no way that we would be able to move her into another Medicare supplement with those because she wouldn't pass the health questions. And they can't take away her current plan as long as she continues paying the premium. So Valerie is in absolutely the right spot. Hon, your premium's probably climbing up there, but I would advise staying in that thing for as long as you can. If we can help you with your drug plan, let us know. But yeah, that's very, very definitely an issue. So you're not risking higher costs. You would be risking being able to get back into a plan similar to what you have at all. You would not get in. So you hang on to that thing and hold tight for as long as you can.
Justin White just went Walter White with, if we can help you with your drug plan, we will. Justin White with SeniorHealthServices.com will be our guest. I still have more questions than I can get to about Medicare. If you're not on it or your parents aren't, you will be soon enough.
Mr. Michael Berry.
Justin White is our guest, SeniorHealthServices.com. What is the best method of signing up for Medicare? These are going to be rapid fire because we spent so much time on John Denver. Find a recommendation from a friend or a broker or the boomer benefits or chapter type larger entities. I'm guessing the question is, the answer is to go to you.
If you're getting, well, obviously we would love that. But if you're turning 65, the best way to sign up for Medicare, if you can figure it out, is to go to ssa.gov and sign up online. That's the easiest way, and then you try to keep you from having to go down to the Social Security office and whatnot. So we will walk you through it just like any of the services that they mentioned. We do it for free, obviously, but that's the best way. Online, and hopefully don't have to go down there and see anybody. That's my answer.
Craig writes, Czar, what regarding Medicare, I just turned 65, and what I did not realize is the cost of Medicare is tied to your income, then add in the Part B, and suddenly the cost is approaching what I pay for my small business health insurance. Still working, so I kept the private insurance. I think a lot of people think Medicare is just free when you reach 65. That's not the case, particularly if you want good insurance with Part B.
Yeah, I would say to that gentleman, that happens a lot where people don't let people know about that IRMA thing, where they means test your stuff. If it makes him feel any better, I would have him go look at the group insurance plan and look at what that deductible was. Sometimes when the costs are the same between Medicare and that group insurance, where you will see savings is most Medicare plans have little and sometimes no deductible. And so he may save some money there. But yeah, that stinks that happens, but it happens a lot. We hear that a lot.
W. Keith. That's an initial and then a first name, just so you know.
Okay.
VA and Medicare, I'm 60% disabled, receiving SSDI and long-term disability. How will Medicare affect me? I'm sorry. I thought I put this in my veteran stack. Is there anything different? Because a lot of veterans questions.
Yeah, no, that's awesome. Well, that's good. They deserve to get help. So, the Medicare is going to give him more choices on doctors because he'll have access outside the VA. And again, there are plans. They're called Medicare Advantage only that just acknowledge the fact that people get their meds from the VA sometimes, but they may want access to doctors outside the VA. And so there are plans that are specifically put together for them. So I would say call in. Let's get you together with somebody. We can show you some options and see if something would work for you.
Czar, out of ignorance, I switched from Medicare with Texas BCBS supplement. Some benefits I used are no longer covered. How do I get those benefits back? Short of going all player. Baby, come back. Any kind of food, kids? No?
They didn't say which
Yeah,
plan they were on. There are some plans that are literally not offered anymore. So if that was one of them, like Plan J from years and years ago, once you're off that, you can't get it back. But so I guess I don't know quite enough information to be able to fully answer that question. Send us a note or give us a call. We'll see if we can't answer you in a little more detail and get the info we need to do it.
Let's see. A lot of questions about after the enrollment plan. I'm trying to amalgamize these. About pre-existing conditions. And I know you spoke to this a little, but this must be a huge deal for folks. And as I said, when you and I have talked about this, I'm going through this for first time with my dad, well, with my parents while my mom's still alive. So this is all very new to me, but I'm noticing the questions that keep popping up again and again. Wanting to change midstream, change horses midstream, but with pre-existing conditions. Can you speak to that generally?
Absolutely. A lot of people ask that. So, yes, if you are changing from a plan, let's say you're in an Advantage plan and you want to change to a different one, because you're in an Advantage plan going to another one, that is creditable coverage, and you will have zero pre-existing condition waiting periods. It just the only thing that changes is who's paying the bill. When you're 65 and you're coming off group insurance and going into Medicare for the first time, forget pre-existing conditions. Don't worry about it. It's covered. I've literally written people with a power of attorney where the person was in ICU and they needed to get them into Medicare. We got it done, and the only thing that changed was who was paying the bill. Great questions. I understand why people are worried about it, but in most cases, pre-X is not an issue. So if you think that you want some further clarification, just call us and we'll listen to whatever situation you happen to be in.
I'm going to tell you this before I ask the question, because I don't want you to be suckered in. And this comes from Ramon, not me. He said every question can't be a great question. So you need to choose one for it not to be a great question, just to build credibility. Wayne writes, regarding Medicare, fair. My employer informed me, this is coming up a lot, some version of this. My employer informed me that I will have to go on Medicare when I turn 55 and that they will no longer provide insurance as my employer. Is this common?
For groups that are for companies that are smaller than 20 employees, yes, that's very possible. So I'm assuming that's probably a small company. If it's more than 20 employees, they can't do that. But if it's less than 20 employees, the small groups, then they have the option whether or not to offer the group insurance to somebody once they become eligible for Medicare or not. So that would be that. Now Ramon's got me thinking I'm going to tell nobody they have a great question. So
yeah, Ramon, people think he's nice, but he says a lot of really kind of hurtful things, to be honest with you. I run interference and soften off the edges. Sammy writes, I've been on insurance for disability through Medicare Advantage Humana. I recently had a transplant. Now why aren't you didn't tell me what you got transplanted? Now I'm obsessed. I am now 66. Do I need to change insurance out of disability?
Insurance out of disability, and has got disability insurance through Humana. I'm assuming that's a Medicare Advantage. Is that what she said?
Yes.
She doesn't have to. I mean, if she likes that plan, she can change if the plan's no longer fitting her needs. She just needs to get a review. If there's something that'll do a better job based on whatever's going on with her, she can certainly change. But she does not have to. She does not have to move if she doesn't want to. If she's on Medicare and on that plan, likes it, she can stay there if she wants to.
I got to this too late, folks, so my apologies before we say bye to Justin. I did have somebody track down what happened to Uncle Jerry's pinky toe, and I do have an update on that. It's going to have to wait till tomorrow, or I'll put it up on our Facebook page, or we'll put it on our blast today, all three of those, which you can sign up for. It's free at michaelberryshow.com. You can find Justin, who is a resource for me and can be for you. You don't pay for it. The carriers pay for it if it comes to that at seniorhealthservices.com. If you can't remember that, that's okay. You can always email me about anything. And in fact, if I don't have a show sponsor, my wife laughs because I'll say, hey, do we know anybody who does this? And she'll say, yeah, why are you asking? I got a listener. She's, what are you, the all-knowing? Well, yeah, as a matter of fact, that's what it means. Yeah.